Good afternoon, everybody. We are a little bit a little low on the attendance, so if you don't mind, can we all come towards the front so we can have more interactive discussions later on as well. Thank you very much. I would like to begin by introducing myself. I am Bianca. I think most of you know me. I am the Partners and Donors Officer in charge of national platforms for the Stop TB Partnership. And I'm the coordinator, and for now, I'm also helping Virginia to chair the session. Virginia Nagy is the chair of this session. She is the TB Control Support Advisor to USAID, for USAID. You can call her Ginny for short. And we have a few countries presenting on the work that they do. Before we go to all that, I just wanted to inform everybody. A national platform is an alliance between organizations which are drawn from the various sectors. It could be from the public sector, the private sector, the civil society sector, and many others, with the whole purpose of coming together and working collaboratively and contributing their core competencies and sharing the risk, responsibilities, and the benefit to achieve the goals, overall goals, to achieve their own goal, the goals of others, and also the overall goal. Now, each national platform has a main focus, which is decided by each country based on the context of the country or what is needed. Some countries look at the national partnership as a way to maybe do advocacy work. There are some who look at it as a way of maybe mobilizing resources. But the whole thing about it is that it is a collaborative network of people working together to come forward to a single goal. So with this introduction, I would like to pass on the session to my colleague, Ginny, who's going to take us through all the various speakers.
Sure. Sorry. Can everybody hear me okay? Yeah, in the back? Yeah. Hi. So as Bianca said, my name is Ginny. I'm with USAID, and I have the pleasure of chairing this session. We're going to have a series of presentations from different national platforms. So first we're going to start with Nigeria, the Stop TB Partnership Nigeria. We have Mayowa Joel, who's going to be presenting to us on identifying TB champions.
Thank you. Good afternoon, everybody. And it's good to see people who have been working like we are trying to do in Nigeria to improve our stakeholders' participation and their contribution in ending TB in our respective countries. Like Bianca had said, the Stop TB Partnership, it's an opportunity for stakeholders at the country level to come together and contribute and complement the efforts of the government and other stakeholders in Nigeria, in different countries. So, and that's what we try to do also in Nigeria. And the presentation I will be making will share more like the story of Stop TB Partnership Nigeria. And it's going to also tell us the challenges we had, especially at the beginning, and some of the success stories we are now having, which some of you might have been, hearing over the social media and other fora. So about the Stop TB Partnership, Nigeria, it's a multi-stakeholder partnership, and that is dedicated to complement the efforts of the government and other stakeholders to end TB in Nigeria. And its main strategy of fulfilling this mandate is to increase political commitment, support and funding, and the partnership comprises right now of the government, represented by the MTP and some other key national agencies or government agencies. And it also has parliamentarians, multilateral and bilateral organizations, development partners, private sector, academia, professional associations, civil society organizations, media, and persons affected by TB. And I'm telling you the truth, this is literally the stakeholders. Each and every of these stakeholders that I've mentioned are represented on the Stop TB Partnership Nigeria. Well, we'll get to the other issue of, okay, yes, they are represented, but is it in the number, the proportion at which we will want? Yes, maybe not yet, but all these people right now are represented on Stop TB Partnership Nigeria. And the vision of Stop TB Partnership Nigeria is a Nigeria that is free of tuberculosis. I don't think there could be any better vision for a national partnership than that, than to see its country that is free of tuberculosis. And our mission is to work in partnership with all stakeholders to end TB in Nigeria. Well, our purpose to complement the efforts of government, as I said, and other stakeholders, advocate for policymakers, religious and traditional leaders, to increase the profile, especially political profile of TB, because if there's anything TB is lacking, it lacks, that political clout, unlike its brother HIV. We want to advocate to the government and donors and private sectors to increase funding for TB. We want to improve coordination amongst all the stakeholders working on TB, improve linkages between TB and other social determinants of health and broader development issues, because as we all know, TB tends to be isolated most of the times. Either even from the health issues, it's like an orphan. If there's any other word we have used more often with TB is, the word orphan. And of course, we want to increase the public awareness on TB through the social media and other forums. So how did it all start? There was this high-level visit to Nigeria in 2006, and there are some few colleagues here that their faces still looks very familiar, with the former president, Olusegun Obasanjo. You see Dr. Mario there, and you see the former executive director of Stop TB Partnership there, Marcos. There's this lady that's also somewhere at the back, Lucy Chesire, and it began from there. And when we met at the Union Conference in 2007, we came together and said it's time that we have this national partnership, and you can see the Nigerian delegates meeting at the 2007 Union Conference held in Cape Town. So, we made true to our promise in 2008 by inaugurating an 100-member membership of the Nigeria Stop TB Partnership, and officially we were able to launch it in 2009. And the present, in the middle on that table, is the former Minister of Health, Professor Babatunde Oshotimehin, who is now the Executive Director of UNFPA. Well, after 2009, that the Stop TB Partnership Nigeria was launched, it was not all rosy for many reasons that I will be glad to share with you later. But so we were there were moments of ups and moments of downs. But there were some few people that stood, they were still very commitment and said that we can make this work. We had technical support in the form of a country mission from Stop TB Partnership Geneva in 2010 and in 2012. All geared towards how to strengthen, how to resuscitate at some point, because before 2012 it was even more or less like dead. That's ironic, but the fact was that all the key stakeholders were still very much believe that there's a potential for Stop TB Partnership Nigeria, despite the challenges we had at the beginning. So, and that time came, and one thing you realize is that after 2012, we were like, we went cold. There was nothing to be heard of. And of course, by 2015, we came back, and we still said we can do this. We don't have to relaunch. We have launched. We don't have to reinaugurate. But there were some few things we could do. Make some changes in the leadership, which, of course, we was one of the problems we had. In between 2012 and 2015, I think it's good to say that we went back to the drawing table and said, why is this thing not working as we wish to? And we really went back to, restructuring the foundation and the systems and policies that are required. Okay. Well, we inaugurated in 2015. By 2016, we inaugurated a new board in 2015. By 2016, because we have new leadership with new ideas, we started to get a lot of brainwaves. And one of those brainwaves is contacting the First Lady if she could be the TB champion. And surprisingly, that she accepted, and that was like, woo! Now we are finding ourselves in a totally new terrain, and I think for the first time we believe now we can begin to achieve our objectives. And in 2016 also, this year has been a very big year for us. We had the first national TB conference in Nigeria, okay, before that, we had the World TB Day. We had what we call award that we gave to key stakeholders, just to motivate them as to, okay, you have done so much to NTB. Nobody has recognized or appreciated what you have done. We awarded some colleagues. We had the first national TB conference, unprecedented. We had over about 1,500 people, while we were actually expecting about 50. So you saw that that's like a big challenge that we had. And represented at that meeting were, Dr. Gooseby, Lucica was there. The wife of the president was represented by the wife of the vice president. And we had a WHO rep, USAID, mission director, and many other high-level personalities. At the conference, we were able to give award, appreciate people who had committed, long time of their energy to ending TB in Nigeria. And at that meeting also, we had other side events that include several meetings with other key stakeholders, especially policymakers in high-burden TB states. Most importantly, also, we had a separate meeting with the wife of the president that we called TB champion, with this high-level or powerful delegates who met with her. And then we had a separate meeting with the parliamentarians for the first time, the parliamentarians, because we run a similar parliamentary system as US, and the parliamentarians were telling us that actually that was the first time they were coming together to discuss TB, and Stop TB Partnership made that possible. And the TB champion, a wife of the First Lady, was also able to attend with her support, or technical support from our side, to attend the coordinating board of the Stop TB Partnership in New York. So since then, we have done many other things with the new Minister of Health. This is a courtesy visit to the new Minister of Health, and as well as the new National TB Program Coordinator, were to inform them about Stop TB Partnership Nigeria and how we can complement all they are doing. Well, what is the value added? Yes, increased political profile of TB, and engagement of other key stakeholders that ordinarily you will not ordinarily see, participating in issues of TB. And a good example is oil companies. We have even oil companies like Chevron that are member of Stop TB Partnership. Of course, we have our own challenges. This we can discuss later. We don't have any funding. Everything we have done has been raised domestically, and there are still lack of engagement of some few other stakeholders. And most importantly, because Nigeria is a very large country, we still do not have presence at the state level. So our work has still been at the national level. Well, there's still a lot we can do as Stop TB Partnership Nigeria. And I think some of these lessons learned will still be shared by some of my colleagues in the course of the presentation, so I won't go into that. So in summary, I think for Nigeria, the quote from Margaret Mead will make a very summary of everything I've said. That never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has. And I think our persistence from 2006 to 2016, 10 years, is now beginning to bear fruit. So I would say that the seed that was sown, over 10 years ago is now, bearing its fruit. And with the current status of Stop TB Partnership Nigeria, we believe we'll begin to see more homegrown support, high-level homegrown support from all stakeholders that will be able to contribute to end TB in the country. I will be available for questions. Thank you very much.
Thank you. Thank you so much for an excellent presentation. We're going to hear all the presentations. There'll be 4 in total. Following that, we'll have a discussion. So I'd like to invite our next speaker to the stage, Evelyn Kibuchi from Kenya, who's going to be talking to us about mobilizing members of parliament.
So good afternoon. Yeah, I'm going to take you through the Stop TB Partnership Kenya, so much like the Nigeria one. And I'm going to take you through the achievements we've made so far and the challenges. So I'll have the strategies and approaches we've been using, achievements, lessons learned, and challenges. Briefly on the background, the Stop TB Partnership Kenya was established in 2010. However, it was not active until 2014, when we got a bit of support from USAID. And so the report I'm going to give is basically maybe for the past 1 year. So our vision is to have a healthy and a prosperous Kenya, free of TB and other poverty-related diseases. So you can note we ended other poverty-related diseases. Just to be sure that when we end TB by 2030, I still have a job. The mission is to make sure is to create awareness of TB in all sectors, or rather, to have an year-round doorstep reaching platform for a healthy and prosperous Kenya free of TB and other poverty-related diseases. So this is our slogan. most people, when they come and look at it, they keep asking me, so what do you mean? And I have to keep explaining, and I'll do it to you even now. It says, do something. It means if you're not already doing something on TB, start today. If you're already doing something, do more, right? And if you're doing more, you can do it better if you work in partnership with others. So that's why it's a partnership. So we tell other people who are already doing something on TB to come, we work together. And this thing is a wheel, actually. And this wheel, it means that when it's just like that, it's static. It's not moving. You need to put some human effort for the wheel to start moving. And so we say, for us to start moving towards ending TB, we have to put some effort. We have to put some resources. And the effort is the effort you put for the wheels to start moving. And now they start moving, all the wheels. What are the strategies that we've been using? Of course, we have to be innovative. And one of the strategies that we've been using is try and get the corporate sector interested in matters TB, increasing political commitments and advocacy for increased resources. We also engage in empowering former TB patients to become advocates and also engaging civil society. And finally, of course, if it's not in the media, it did not happen. So we work closely with the media, building their capacity and engaging them. So what does the Stop TB Partnership do differently that is not being done by the rest of the institutions? What we've done is that we have categorized the Kenyan population into 10 settings. And the assumption is that if you're not in one setting, you must be in the other. If you look at those settings, the 10 of them, at any one point, you must be in one of them. The living settings, if you're not in your house, then maybe you're in an institution learning, maybe you're in a church or a mosque, or you're in a sports setting, or you're visiting some place, or you're in the traffic. You must fit in one of these. Or you could be in prison. So we try and make sure that our strategies, our approaches are reaching all these settings. So we shall see what efforts we've made to try and reach the settings. We have not managed to reach out to all of them, but we are getting there. So some of the achievements is in the mobilizing of membership. We said Stop TB is a membership organization. And membership is drawn from the private sector, civil society, government institutions, patients groups, civil society, and the like. So we've been able to register about 80 members so far in the past 1 year. We've also been engaging non-medical institutions because we feel for the longest time we had left TB to be in the hands of doctors. So we want to get out of that, and we are trying to reach out institutions that are not medical to get interested in TB, like the churches and the private sector. And for the private sector, I want to give an experience of how, or some of the achievements we have made by engaging the private sector. When we approach the private sector, we do not tell them to give us money. Because of course they'll tell you, the government has a lot of money for health, why do you want more money? And of course they'll talk about accountability. So what we tell them is that you can contribute to TB in your own core competencies. And we approached one of the horticultural farm, and we wanted them we asked them to see what they can do for TB. And they said, okay, maybe we can be printing TB messages in our materials. And one of the things they thought was immediate and they could do at no cost was to print TB messages on the pay slips of the workers. It doesn't cost anything, yet it's going to reach out to all the workers in their farm. These are just some of the examples. When we are visiting some of the corporate sector, the first one is a roofing company. It's a company that makes roofing materials for houses. And the second one was a visit to the chairman of the Toyota, the company that makes the Toyota vehicles. Yeah, so the message to them is, look within yourself, what strengths do you have and what do you think you can do. Yeah, this is a visit also to some horticultural farm. And it's interesting that some of the horticultural farms, when we went and talked to them about TB and they looked inside themselves and they said, okay, we've been having TB cases and we don't have health centers within our farms. We refer them outside and they don't even have any follow-up mechanisms. Once they tell a patient to go and be screened, they don't bother to follow up. Were you screened? Were you found with TB? And if you have TB, what did you do? So they actually accepted to be screening their workers periodically. And some even agreed to set up TB clinics within their farms. Okay. Sorry. Talking about the sports, the settings I said, this is an example of reaching the sports population with TB messages. So this is a meeting of referees. And one of the international referees, we have trained him on TB. And so whenever they meet together, he's given a platform to talk to them about TB. And this is just one of the examples of such forums. So political commitment, sorry. Stop TB Partnership is a secretariat of the African TB Caucus and also the National TB Caucus. I'm sure throughout the conference you must have heard a lot about the presence of the members of parliament, and we had quite a number in this conference. So we are the secretariat, and when the Barcelona Declaration was made in Spain, the Stop TB Partnership came and domesticated that Barcelona Declaration, and we made the MPs sign onto that. So this is a forum where they were actually signing onto the Kenyan parliamentary commitment on TB. Okay, these are just some of the activities that we have been engaging the caucus. Like I said, we also the secretariat of the African TB Caucus, and the meeting that was held to establish the caucus was actually organized and hosted by the Stop TB Partnership. So this was the meeting that was in March, and the caucus was launched in Durban in July this year. That's still the same meeting. Okay, we have identified former TB patients as really instrumental in creating awareness on TB. And we have also realized that you don't have to have been affected personally to become a TB ambassador. Sometimes it's just becoming affected, not infected. So this young man is an artist. He was orphaned by TB when he was 3. And so when he grew up and he realized he had the talent, he thought, what can I do in honor of my parents? And he decided to sing for TB. And so we have been working with him, mentoring him to use his music, his talent, to promote or to profile TB. So this is him on World TB Day this year. And actually, as you can see here, he has done a very nice song for TB, which has been adopted by the government as an anthem, so to call it, for TB. And so whenever the media is doing a program on TB, the song is played. Yeah. This is also a former MDR TB patient. He's also an artist. We've been working with him when we are visiting the companies. When he shares his story, then he moves, he touches them in a way that they want to do something on TB. So we've been looking for such people and mentoring them and supporting them to do something on TB. Yeah, on resource mobilization. Like I said, we have just been around, effectively for 1 year. So we may not have been able to raise resources, but we are very conscious of guarding the TB resources that we already have. So I just want to touch on an example of how we have been able to safeguard TB resources. Some county government, for those ones who may know the government system in Kenya, we have devolved into what we call counties. And one county decided to grab, okay, that's the language used in Kenya, but they actually decided to take land that we had, that there's a TB hospital, and they wanted to convert it to their offices. And so a Stop TB partnership with the responsibility of doing resource mobilization for TB, we stepped in. We did quite a bit of advocacy using different methods, including media. And eventually, after quite a number of weeks and negotiation among the government, they agreed to give back the land. And so this is just a letter writing to the Stop TB partnership saying, we have listened to your argument on TB and we have agreed to leave the land to the hospital. So that's one of the achievements that we're really proud of. Talking about media, we've been mentoring media. Whenever we have an opportunity, we brief them, we keep updating them on TB, and we act as a link. We link them to resource people, either from the government to experts, or even when they want to interview patients or former TB patients. And we have been able to generate a lot of media, as you can see, even there. And for the past 1 year, we may have generated over 300 media stories, either online or in newspaper or even electronically. Lessons learned. We realize that there's huge potential in the private sector, the corporates. I think we assume that they cannot invest TB, but we have realized is we have not been approaching them. So there's an opportunity there that we need to look into. Challenge, just like my counterpart in Nigeria. We don't have funding for Stop TB partnerships. Even when institutions have funding and they come to a country, they will look for institutions that are doing other diseases, malaria, HIV, and they will be given the money for TB to implement, while we have the Stop TB partnerships in country. So that's a huge gap, and I would challenge funding mechanisms to think about channeling funding through Stop TB partnership. Way forward, I want to quote from Albert Einstein, who said, insanity is doing the same thing over and over again and expecting different results. And really, I don't think that's who we are. That's why we really need to be innovative, look into new things, new strategies that have not been implemented before. And I think the national TB platforms are the game changers that will deviate from doing business as usual and bring new energy, positive energy that is going to deliver us to the Stop TB, ending TB by 2030. Yes, and our telephone. It's quite important, and that's why I put it there. I'm not in any way promoting Nokia phones. After all, I think they're out of market. This is our number, 909090. It simply defines the TB targets by WHO. And why we specific purpose to have this number is so that we can sensitize people on these targets, and we can keep telling people this is what we're working towards, so they can join us to work towards that. And we have put our best foot forward. We want to work with other partners, we want to work with other stakeholders, and ensure we believe it's achievable to end TB by 2030, only if we work in partnerships with other institutions. So, thank you very much. Yeah, and finally, I want to really acknowledge support from USAID, the National TB Program in Kenya, other institutions that have really been supportive in even mentorship, the International Organization for Migration, Global Fund, WHO, and also AMREF. Thank you.
Thank you very much for a wonderful presentation. Next, we would like to invite Amelia Sarmiento from the Philippines, who's going to be talking to us about partnering to implement national tuberculosis programs.
Good afternoon to everyone. I think our partnership is one of the oldest partnerships. We already celebrated our 20th year, and we're looking forward to our 25th year, silver anniversary, 2 years from now. So it's even older than the Stop TB partnership in Geneva. How do I do this? Oh, sorry. To the right? Here. This one, okay. Our partnership in the Philippines is called the Philippine Coalition Against Tuberculosis. We call it for short the PhilPACT. It was conceived way back in 1993. So you must, if today is 2016, 1993, 2016 minus 93 is 23 years old, no? And I have been working with the partnership for the last 16 years as the secretariat. During the time it was conceived, we really had the highest levels of TB in the world. And there was very low public awareness. And the importance of TB as conceived by the public was also very low. And the public and the private sector were not trusting each other. No, that was the idea then. Then this one, the private sector and the public sector attended a conference, IUATLD conference in Bangkok. They were caught in the traffic. And so the private sector said, oh, do you believe what the Philippine government was telling about the situation in the Philippines? So they were trying to not to believe what the government was telling, but then they said, why don't we just talk to each other and help the public so that we can move forward and not like the traffic here in Bangkok. It's a standstill, no? So that was the idea then. And I would like to acknowledge Dr. Jeff Sui here. The one who made this was the brother. So Dr. Jeff Sui is from the Philippine College of Chest Physicians, one of our partners. That's why we have a very strong partnership. So these are our founding members, the Philippine College of Chest Physicians, the American College of Chest Physicians, the Microbiology, the PISMID, the Philippine Academy of Family Physicians, the Cure TV Foundation, the Philippine Tuberculosis Society Incorporated, and the Department of Health. From 7, we are now 66 members strong. So one of our greatest achievements is the scaling up of the public-private mixed dots strategy, which we have been doing since 2003 to 2011 under the Global Fund Project. And it is really very important for partnerships to grow so that you will be able to become sub-recipients of the Global Fund Project. But it is really challenging to get funds from Global Fund because you have to grow financially, you are able to do things administratively, but it is very important because it is a source of sustainability. One of the things that we did was to set up a national coordinating committee for public-private mixed dots. The function is to oversee the implementation of the PPM strategy in the Philippines, set up 16 regional coordinating committees, and Dr. Jeff Sui here is one of the co-chair of one of our regional coordinating committee, 44 PCCs, and we set up 221 PPMD units where private doctors will be able to refer their patients. We were able to engage 3,000 private doctors during that time from 2003 to 2011. And one very important thing that we were able to do is we were able to contribute to increasing case detection and for the NTP to achieve. At that time, it was 70%. So NTP was able to achieve the target of 70% in 2004 from referrals from the private sector. So at that time, there was a standstill of the case detection rate of the public sector. So what we did was to engage the private sector, and we were really able to increase case detection and achieve at that time the 70% target of smear positive cases. The contribution of the private sector then in 2009 was 7.4% of the CDR. One of the things that we also do is to support the Philippine Plan of Action to Control TB. This is a plan of action of the Department of Health. In 2010, There was a plan of action until 2016. In 2013, there was a joint program review, and we participated in the joint program review. After the 2013 program implementation review, the PhilPACT was revised, the plan of action was revised, and then in 2016, we again participated in the joint program review, and we're now coming up with the 2017 to 2022 National Strategic Plan as a response to the Global Plan to End TB. The partnership is an active partner of the Department of Health in doing all these things. In the plan of action, the 2010 to 2016 plan of action, one of the strategies there, we have 8 strategies, and strategy 3 is to engage both public and private healthcare providers. And this is where the partnership is actively involved. So we have all the performance target under that plan of action that all provinces should have this referral system. 90% of hospitals and 65% of private hospitals will be participating in TB control. 15% of notified TB cases are coming from the private sector. And all that facility staff are equipped to deliver quality TB services. In all this performance indicator, the Stop TB Partnership in the Philippines is participating in the implementation of this strategy. So 3.2 performance target is to engage 90% of public hospitals and 65% of private hospitals. So what have we done from 2012 to 2015? We engaged a total of 996 hospitals. So out of that, 493 are private hospitals and 503 are public hospitals. So we contribute 45% to the target of 65%. So we did 45% of the job for the engagement of private hospitals, and for the engagement of public hospitals, the Stop TB Partnership in the Philippines did 69% of the job. So it was a partnership between the Department of Health and the Stop TB Partnership. And again, we are a subrecipient of the Global Fund. That's why we are able to do this. So on the right side, these are the location of the hospitals we were engaged, and it's really all over the country, the Philippines. So we're now working in 11 regions. As far as another indicator is that 15% of notified TB cases should be coming from the private providers. So what have we contributed, the Stop TB Partnership, to this performance target? So we have really detected from the hospitals that we engaged 600 hospitals recently. So 60,802, 6.8% contribution from the public hospitals and 2.1% from the private hospitals. We also did capacity building of those in the hospitals. So we have trained a total of 1,332 nurses and physicians. And within the hospitals, we also did orientation of health workers. And we were able to orient 17,409 healthcare providers. One of the things that we also do is to organize a convention similar to this union conference. Since we have been doing this since 1995, and this is also a source of sustainability for the partnership because we charge registration fees, just like the union conference. The one that we did in 2016, when we organized this, it's always in partnership with one of our members. The 2016 conference was with the Philippine College of Chest Physicians. The 2016 was with the Pediatric Infectious Disease Society of the Philippines. In 2016, the focus was adult TB. And in 2016, it was to end TB in children. Another activity that we always do is the World TB Day. We have been doing this since 1998. No? And then it's always done with a partner, a member of the coalition. Last time we had it with the Philippine Academy of Family Physicians. And we also take this as an opportunity to launch events, like, for example, the TB Diabetes Initiative of the Philippine Tuberculosis Society. Our most recent activity is Ending TB in the Workplace. We call it TB Advocacy, TB ABC, TB Advocacy in Business Communities. And we're organizing this with 5 local PhilPACT coalitions, with the Department of Labor and Employment, the Occupational Safety and Health Center, the Trade Union Congress of the Philippines, Employers Confederation of the Philippines. So far, we have reached 115 companies. And most recently also, we came up with clinical practice guidelines. This was done by the professional society, so there's an easy buy-in. It's marrying the ISTC and the Manual of Procedures of the NTP. And so far, we're doing dissemination. We already reached 1,219 private physicians. What are the lessons learned? Partnership plays a vital role as conduit of the NTP to get the commitment of the private sector. And we need continuous strengthening of the partnership's organizational capacity and capability. Challenges really is sustaining and optimizing the contribution of the partnership and sustaining the interests of the members to participate in all the activities. So what we will do is to make sure that we continue to grow and we have access to funding, like Global Fund, and we have to work closely with the NTP, and we have to ensure that our members are actively involved. We have regular meetings and technical assistance for our members. So, since the partnership is a very important partner of the NTP, so to NTB, the partnership in the Philippines should continue to unite, lead, and inspire stakeholders in the private sector. Thank you very much.
We'd like to invite Paul Asiko from Uganda, who's going to be talking about strengthening collaboration between all partners and engaging with country coordinating mechanisms.
Good afternoon to you all. I'm from Uganda, and I'm Dr. Asiko Paul. I'm the AD for Uganda Stop TB Partnership. My presentation is on strengthening collaboration between TB partners and engaging with the Global Fund, Uganda Country Coordinating Mechanism. My colleague who has just been here has told you about the great work that is being done in collaboration with the Global Fund. Okay. So let me tell you something about Uganda Stop TB Partnership. It's a non-profit making non-government organization that was formed in 2004 to support and coordinate non-public partners engaged in TB control in Uganda. And the partners that subscribe to Uganda Stop TB Partnership are required to contribute to basically to the National Strategic Plan for TB, so that the country is working in a coordinated manner and without everybody doing whatever he wants. We all want to contribute to one national strategic plan. And in the partnership, each partner brings specific expertise, experience, resources to contribute to the national response. So, our vision, I see, is not so different from the other visions. It's just like the Nigerian vision. We look at the ultimate. We want to see a TB-free Uganda. So as much as we're talking about stopping TB, as that we are a Stop TB partnership, we had already foreseen that we wanted to end TB. So we were quite ahead of it. And basically the objectives of Uganda Stop TB is to achieve and sustain the national TB. And it's not just TB program. Our national TB program is also with the leprosy, as much as leprosy is becoming already not a very big issue, but it's still there. So case finding and cure rates. And to the partners we work with, we want to provide them with right information, accurate information about TB and the fight against it. In many of our settings, getting the right information is not easy. There has to be an organization that provides it. Otherwise, if you just walk into some of the government offices, you may ask for it forever. So we thought this was really something that we could do for our partners. And then we also want to promote advocacy, communication, and social mobilization for TB control. This is something that we do, and which we are proud to say that I think it's only us who can really do it best for tuberculosis in the country. And then, of course, to coordinate all the partners or the agencies and stakeholders to fight, to contribute towards the fight against TB control. And at the same time, we subscribe and maintain a relationship with the Global TB Partnership. Overall achievements, we started just as an association. We were basically registered as an association to begin with because we were bringing together members, so we thought it was more of an association. But with the time, we realized that being an association, a company, actually we were registered as a company, a limited company, we were not doing ourselves enough favor. So we decided to register ourselves as a non-government organization. And by registering as a non-government organization, it has helped us to be able to mobilize resources. And our membership continues to grow. We have a membership of about 65 members, and this includes international and local organizations from all walks of life. The private sector, the public, the non-public sector, NGOs, civil society organization, mention it. And we have 3 working groups which are really very active. We have the TB-HIV working group, we have the dose expansion working group, and then we have the advocacy, communication, and social mobilization working group. And they are really very active. They have been able to help push the TB agenda in the country. And with the support of Global Fund, we have a fully functional secretariat. I've been at the secretariat. This is actually my 4th year. And because we work with the Global Fund, then we also work very regularly with the country coordinating mechanism to make sure that things work out very well. And because of the funding, we now can hold monthly working group meetings and quarterly working meetings for our partners, such that all their agenda is brought forward. We share experiences through those meetings, and then we are able even to, through the working groups, to do a lot of things on behalf of the National TB Program, which they wouldn't have done. For example, things like we're able to write the advocacy, the communication strategy, and which is now being used there for the whole country. And that was done by the Advocacy, Communication, and Social Mobilization Working Group. And then we carry out a lot of advocacy for political commitment. Actually, just last week, thanks to Evelyn, Evelyn from Kenya was there also to witness our launch of the parliamentary caucus in Uganda. We were able to launch the parliamentary caucus last week. And Before, the TB constituency was not being represented at the CCM, but through our organization. Now, with the TB constituency is being represented on the CCM, and a lot has happened because previous CCM was looking more at HIV and malaria, but now TB is also being prioritized. Actually, this one, this is a session where that lady at the front, she may not be in here, but she's around. She's attending another meeting. She's actually our CCM member, and that meeting was actually one that was organized by Uganda Stop TB Partnership, and she was elected. She's called Dorothy Namtamba. She was elected as our CCM representative. Of course, even with her deputy also was elected during that meeting. So we now have at least representation on the CCM, and TB is now being had and taken care of. So these highlighted achievements and value added. What is the value that has been added? Platforms for coordination of partners gives opportunity for sharing experiences and learning from one another. It's really very, very, very important. We are talking about partners from all over the country whom we want to work in a coordinated manner. You provide them a platform. They share experiences, just like we are here. We are sharing experiences. And when people go back to their own working settings, they can be able to replicate or be able to improve on what they have been doing. And by each partner bringing expertise and experiences, a lot of resources are mobilized for TB control in the country. And one of the things that we really pride ourselves that we do very well is that we've been around the World TB Day. We don't just do World TB Day, we do many activities around World TB Day, which actually stretch not just in the month of March, but even beyond. Even up to now, we are still doing those activities. So we were able to enable community to get knowledge on TB disease, and has contributed a lot to community empowerment. This is just an example of, this was World TB Day, and which for this year, 24th March, and we awarded certificates during our World TB Day to patients who had completed really MDR treatment, had got cured. And you can see them. These have really undergone, really been at it for several months. And they are really looking good. They have been cured. And they are best examples to the community. Actually, now we are in the country, we are using these ones to be able to be role models to the rest of the patients that even with MDR, well, you can get cured. So lessons learned, a fully functional national partnership for TB can be able to effectively engage partners, support the national TB strategic plan, and contribute in a coordinated manner to the response. So that is extremely important, to be able to mobilize all the other people, because we write strategic plans and they remain on paper, but functionalizing them is another. So when you mobilize partners from different angles, you'll be able to work in a coordinated manner to support that strategic plan and be able to get your indicators right. We are using the Engage TB approach. It's coming late, but WHO has the Engage TB approach. We realize that when we are in the capital city and just talking to the already converted organizations, the big organizations, as I said, that there are 65 members that we have, we realized these are not really reaching the communities. And using the Engage TB approach, we have gone down to meet, to engage those smaller CS or civil society organizations and partners down there at the community level to be able to integrate TB in their day-to-day activities, and it's working very well. And then we also work with the media fraternity. Engaging them in the TB response is really, really, really very, 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 very good and very useful. I think it's Evelyn who said if you don't talk about it, then it's not done. So using the media, they can be able to broadcast what you want. And once you have given them the materials, we printed for them materials, we organize meetings for them and empower them, then they can be able really to talk on the media channels about TB. And then working closely with the CCM to do community dialogues. We do, with the CCM, we go down and meet the different people who are affected by tuberculosis so that we come to know what are the real perceived needs that need to be brought up so that they are really captured in the national strategic plan and the planning processes of Global Fund. So by doing those constituent engagements, which we do around the whole country, we can be able to provide an opportunity for including the critical needs in the TB-HIV concept note. So that has been really very, very good. And for national partnerships to implement their mandates, they need predictable funding and support. So that's just a pictorial representation of community engagement. We've gone out, and incidentally, the HIV sector is has been more organized Actually, when we go to reach out, actually, you may find that about 85% of those people who came to for that meeting are living with HIV because they already had their networks and already more organized. So we are reaching out to them. Instead of replicating, they already organized structures. And this is also one of the meetings where we are engaging stakeholders actually to be able to come up with their issues so that we take them up at the extreme end. On the other side, that is our deputy CCM representative. Challenges. It's difficult to meet the expectations of the smaller civil society organizations in our partnership, and they expect a lot from us since we are their representatives at national level, but at times it's really very, very difficult to meet them. And when you have a smaller secretariat, it can be overwhelmed by fulfilling its obligations. I will need to learn a lot from the Philippines. Because we have gone that side also of engaging the private sector in the private-public mix, and there's a lot to learn. So human resources and other resources are greatly needed for a fully functional secretariat. And the registered members of the partnership need to commit themselves to support the partnership because sustaining it is not easy without funding. And the national partnerships should widen their scope, go beyond the traditional health-related sector and this, or the health-related, the traditional TB, or the health-related section of the civil society. Go beyond it. Go to the private sector. Go to, yes. And then national partnerships should be more innovative. I think we need to be more innovative in identifying and mobilizing international and local resources. That was also for World TB Day. These are actually also cured patients, and they had a drama group, and they are demonstrating on the World TB Day event. That is also on World TB Day. Children at the forefront, they become the game changers eventually once you give them the knowledge, empower them. That's still drama by the school children. We go and train them, and then we give them themes, and then they demonstrate. They do drama shows during the World TB Day. And just about a month ago, with a lot of mobilization, we were able to launch the National Coordination Committee for Tuberculosis. In the center, that lady in a suit, checkered black with a bit of yellow, is our new Minister of Health. And next to her is the program manager. On the right, is that the right? Then on her left is the country director for the union. So that is now the NCC. And I think, thank you for listening to me.
Thank you. Thank you to all the speakers. You know, as you can see, there is a need for the strengthening national partnerships. Every partnership have their own strength, and they're really moving forward. But what's going wrong? Why can't we actually, you've seen, there are a lot of lessons learned, there are many challenges that everybody faces. We've heard of expertise from identifying TB champions to mobilizing the political commitment and to also collaborating to work with private sectors and of course the CCM and working with global fund processes. Before with the permission of the chair, we decided before we move into the question answers, and also I have one discussion slide that we could look at, maybe we could just take a look around the room because there are many other partnerships in the room, and if you can just briefly tell your name and where you're from so that we can then go.
Yeah, good afternoon, Bianca. My name is Subrat Mohanty. I represent Union for the India office. I closely work with the India Partnership for TB Care and Control. And I'm glad that I'm here and learning the things from other partnerships. Thanks you.
I'm Mercy Annapurani. I'm one of the members of the Governing Council of the Partnership for TB Care and Control in India. And also, we are also part of CCM in India, CCM. We have more than 200 members in Indian network of NGOs and hospitals working, and also the Affected Communities Forum is also represented there in the network. And recently we had our national consultative meeting last week in New Delhi, and a lot of issues were discussed. And we have, since India is a large country, we have regional networks also. Southern network, north, east and west, and in which southern network is registered separately as a the southern chapter of the PTCC. And we are going ahead on implementing programs by mobilizing resources from the local network. And we also have planning to, in fact, we have already started of collecting membership subscriptions. That's what I wanted to ask in the Q&A hour now. And I have learned something more from the other networks here, like Philippines and the other African countries also. Definitely I will go and share with our team. We are going to have our board meeting in the November 2nd week. So I'll have a chance to share what I have learned from you here. Thank you.
Just quickly for everybody.
My name is Frank Bonsu. I work with the National TB, the Stop TB Partnership in Ghana, representing the public sector.
Thank you. I am Muyabala Munachitombe. I'm a medical doctor. I am the chairman of the Swaziland National Stop TB Partnership. I'm also the president of the Africa Union section. I'm also very glad to have heard, but like Bianca has said, I think the concept of partnering for TB was really for each partner to come with his comparative advantage. The TB partnership concept is very, very important. I just hope that the Stop TB Partnership Global will realize that they are there to strengthen national TB partnership. There is no TB at global level. So the people who actually will reduce numbers of TB are national partnerships. And so I hope really that is the aim. Thank you.
Yes, thank you. Hello. My name is Amina Fakir Knipiler. I'm a pharmacist and I'm from the private sector, from Sanofi, and I'm in charge of partnership within TB program. And really we are committed to PPP, public-private partnership. And so here we heard from the presenters that it's key today.
Hello, my name is Costa Antonopoulos. I work for the Access Campaign and Doctors Without Borders here in the UK as a policy and advocacy advisor. Thank you.
Thank you. My name is Agatha Mshanga. I'm from Tanzania. I'm working with the National TB and Leprosy Program, Minister of Health and Community Development, Gender, Elderly and Children. It's such a long name. And I'm coordinating advocacy, communication, social mobilization activities. I'm glad to be here. Tanzania is embarking on a process of formulating a Stop TB partnership. So at least I'll get some contacts because we need to learn some experiences from our colleagues from Uganda, Kenya, and hopefully Swaziland to help us move forward on the areas of governance, organizational structure, and financial sustainability. So at the end, we shouldn't fall into those maybe problems which they have encountered during the process of formulating their partnerships. Thanks.
Hello, my name is Lilian Ishengoma. I'm working with the National TB and Leprosy Control Program in Tanzania, Community TB Care Coordinator. And actually I'm working very closely with the ACCM coordinator. As you have heard from her, we are in the process of initiating Stop TB partnership. So we have learned a lot from you, and we will continue to contact some of you so that we can get more experience from you for us to start the Stop TB partnership. Thank you.
Thank you. I am Bhavin Vadera. I am consultant to National Program for Public-Private Partnership from WHO India.
Steven Macharia is my name. I am a senior technical advisor to the National TB Program in Kenya. And I am here to learn more about this partnership. And I think there's a lot of potential that can be tapped to help improve on patients' care and support at country level. Thank you.
Yeah, I'm Samuel Koto from Ghana, Kick TB Ghana, working with Stop TB Partnership and the National Tuberculosis Program. Partnership with them.
Hi, I'm Kayla Novoa. I work for Comonix, and I'm currently implementing a project in Ukraine for TB.
Yeah, my name is Ulo Benson. I work with Amref Health Africa in Kenya, project manager for Global Fund TB project. We work closely with Evelyn, the Stop TB partnership. Thank you.
I'm Dr. Jennifer Wee. I'm a pulmonologist. I'm with Ami Sarmiento at PhilPACT.
Hi, my name is Elizabeth Kane, and I work with the USAID team in Washington on the tuberculosis communications team.
Hi, I'm Anuki Panton. I'm the communications advisor for USAID Washington.
Thank you so much. And I know you have a lot of questions. I'm going to quickly go through the slide, and then we go, if the chair would be okay to, then we take questions and begin discussions. You know, one of the things we wanted to take out of this meeting was to gather ideas and inputs onto how do we do this? How do we strengthen the engagement of the national platforms? As you heard, there's a lot of value added being from the national partnerships. They play a very strong catalytic role because this is an organized partnership which has multi-sectoral engagement. You have the public sector, you have the private sector, you have this civil society, media, academia, you name it. This is one opportunity to get everybody on one platform. And as partners, you have a really strong, it's a strong conduit even for, getting commitments from the various sectors. You can work with the CCM to do more community dialogues, constituency engagements, and you heard that the national partnerships could be the game changers, from the usual. We're all looking for a paradigm shift to NTB. The national platforms could be this game changer to actually making things happen. You are often when you do things on your own, you have success up to a certain degree, but when you all join forces, it gets amplified and you have a lot more successes. So as we heard from all today, that there are challenges to why this could not happen. Everybody has, so I've actually just committed, put them all here. One is that it requires all the stakeholders to be supportive of it. It's not only just one sector moving everything ahead. It should be partners collaborating, working together, sharing risk, getting their roles and responsibilities straight, and also getting the overall commitment. All of this is needed to be more effective. For them to be actually to implement their mandate effectively, they need predictable funding and support. We heard from 2 partnerships who have managed to get funding from the Global Fund, from Uganda and also the Philippines. This is because they have managed to put their proposal into the Global Fund proposal, and that's why money comes in. I know that the India partnership used to have that as well, and they have a part of it which is going through. However, there are many other partnerships out there who have no sustainable source of funding. To actually work, you need the secretariat to be able to communicate and coordinate with partners. It cannot be done by just one, and if there's no funding for these people, it's difficult. There is, of course, an increasing need to strengthen the organizational capacity for the partnership, and also to look at how everybody can get capacity building so that they can improve all their gains and ensure viability. So this is basically the slide that I just wanted to put up there. So if we can.
So now we're going to take some questions and some discussions. If anybody had any questions for specific speakers, please let us know and identify yourself with any questions. So we have about 15 minutes. Thank you.
Yeah, thanks, Jenny. It's not a question for the speaker. Thanks to all the speakers for the very good presentations. Since I'm involved in the partnership things from 2009 onwards, I know Bianca and others how we did the work in India partnership. My point here is that I always make 3 statements that what is needed for the partnership. The first one is a clear statement. So it's a national government, other donors, other program managers who are supporting partnership, they should make a very clear statement that they would like to work with the partnership. Otherwise, partnership will never sustain because partnership should be a part of the national TB control program. Second is that the commitment that we commit to do. We are there to do all these things. And third is the investment. And people should start looking at the partnership that they should invest in partnership to build the capacity of the partners, because partners want to be engaged, involved. 200 members partnership in India or 100 or partnership in Uganda, Philippines and other. They would like to be involved and engaged. They want to build their capacity. Being a member of the partnership doesn't actually end the show. It has to be something beyond it. And for that, we require investment in the partnership. And that is what we needed. Thank you so much.
Thank you, Mr. Chair. Without trying to be provocative, and I'm known for that, I would like to commend all the speakers, particularly Philippines. We have a job to do. 2020, 2030, we have targets to achieve, and we should not lose focus. And that is what this partnership is all about, working to achieve results. Yeah. Now, I see presentations. Granted, Philippines has years of experience with partnership. And I have also seen 3 wonderful presentations from African countries. And they start with funding as the problem. And then I see Philippines, when they were about to start, they did not ask for funding. How do we achieve results? I see great pictures of people dancing, wonderful politicians, beautiful legs being shown. And I see graphs showing results being shown. If we want to raise, we must show results to get that money. If we show that results, we will be getting that money. I can tell you that 10% of cases notified in Ghana is from the private sector, is from the partnership. They have funding, they have secretariat, and they can mobilize more because they are working. So I want us to have a paradigm shift the way we have that red thing. We should not let lack of funding defeat us.
Thank you very much. I think we are very happy, really. Thank you for this wonderful revival of national partnerships. I think if from Berlin, and then it was, I think, France, and then it was another place, there have been always stories of what partners are doing. For me, really, I think I would like just to add that what I've heard from the presentations of today is I've heard some partners who are skewing into one area. And then I've heard partners who are broad-based. And I've heard partners who are reflecting a certain sector. But really, I think we need to emphasize that the TB program was a government program that was tackling TB in a country. And there came to a point where countries, especially the World Health Organization, realized that the TB program alone cannot be able to tackle TB. It needs other partners. And it, in fact, realized that in every country, there were people already doing TB services, even if they were not reporting to TB program. So the partnering really is a platform where each one who is contributing in whatever capacity or whatever form should be part of the coordinated activities in a country. And usually the partnering process, like for those who are in Tanzania who want to learn a bit of what is happening, is you meet all of you, just call everyone doing TB, let us have a meeting, and you map out who is doing what is happening. And from there you establish a board that will actually develop some policies for that partnering. And then you develop a secretariat that becomes a technical wing of your partnering that will be dealing with things as we have heard from Uganda and the rest. But what I'm surprised is that Global Fund is also double-edged. In some countries, it does not recognize any partnering at all. For example, in Swaziland, we started partnering. We were an example brought at every platform to explain what partnering is, how do partners come together to form a funding mechanism for them to. And at some point, Global Fund just said, we don't know what a national TB partnership is, and we are dead almost right now in Swaziland. And I hear in Uganda they are supporting them. They have a secretariat. They have a doctor friend of mine standing as an executive officer, which means it's a big salary that they have allocated to that. So really, I think the problem is not national TB partnership. The problem is the global Stop TB partnership. You don't know the mandate you have. Because if you had a mandate, you can tell a Global Fund, if you are funding for TB at a nation, whom are you funding? You are not funding CCM. You are funding partners who are doing activities. And those partners are found in Stop TB partnership. So if you refuse to recognize them and strengthen them, why are you giving the money to a nation? For what? For who? So for me, really, I think the death in some countries, the lack of support from Global Fund in some countries is a reflection of misplaced aims within the global Stop TB partnership. Let us tell Global Fund, let us tell USAID, let us tell whoever has money that the way we can end TB is to strengthen partners because they are tripartite grouping in the partnership. Private sector, public sector, and civil society. Civil society is very strong on advocacy and all the others. They come to the partnership for that. They do not take the partnership and it becomes an advocacy partnership. No, they contribute their strength in partnership. The TB program is good in biomedical arrangements to the TB patients. That is what they contribute. The private sector is a source of funding. That's what they contribute to them. So for me, really, I feel so aggrieved to find out that we are double standards and we do not follow on what we do. For example, in Swaziland, the detection rates were high, the cure rates were high, the government recognized it, the king even declared TB an epidemic, and they brought all the money. But when Global Fund says they don't recognize the Stop TB partnership, everything crumbled. The indicators now are going up, detection rate is going down. So for me, really, I feel that we need to have a voice from the Global Stop TB partnership. Can you say your constituency is not organizing partners at global level? You organize those partners at global level in order to give you funds to capacity build national Stop TB partnership at the local level. Just like the World Health Organization, it has country offices. Union has country offices. You need that.
Thank you.
Sorry. Yeah, just a bit. I just wanted to clarify on one thing. You know, when it comes to from the Global Stop TB Partnership, we have one mandate which is equal for all our partners, all our national partners. For the success of the national partnerships who have managed to get the Global Fund funding, we have had nothing to do with it. It's been a countries who they've moved it forward. Yes, we need a voice, and yes, we will work hard to make it well known from now on this with the Global Fund as well. And also, of course, Dr. Una, you've met with our executive director, and I'm sure she will take it forward. But I just wanted to clarify that with the successful of the different teams, it's not because we were, doing it separately. It was under one voice of all the national platforms. So I just wanted to clarify that. Yeah. Thank you.
Yeah, I just wanted to make a comment in terms of is there a possibility of moving towards some level of standardization? Because we are seeing what is presented here among what's happening in the different countries. We probably cannot get to a point of saying we are comparing them because it's not like for like. For example, if the Uganda moves to the point of registering this as an NGO, the others have remained at a different level, is a totally different level of, let's say, having the things done. So I was thinking probably it would, at some point, be useful to really say that when you form this partnership, the first things that you'd really want to see are ABC. As you move to another level, probably there should be this and this which are brought on board. Ultimately, we should then have indicators that are able to really demonstrate results that people can then use to provide this funding. But if that then is not defined, I'm seeing a risk of, let's say, some really stagnating and probably dying after the formation. Because the membership that are coming on board, some are relying on the partnership to also give them a level of significance to which they can attract funds independently. Yeah.
Okay.
Thank you. I also just going to make some comment, despite the fact that I was also presenter. I think first and foremost, my comment will be to Stop TB Partnership Geneva. And Bianca, you know me, I've told you this several times. I think Stop TB Partnership Geneva needs to do more. I mean, playing that facilitating role. Yes, you see, I understand the fact that at a point, because with my over a decade relationship with Stop TB Partnership Geneva, there was a time it was actually also even putting money into the countries, and it was not getting result because those initiatives were not homegrown. Okay, now we are seeing increasing, should I say, interest of people who want to do things in their country. And I'm sorry to say that it's not at this time that Stop TB Partnership Geneva should develop a code fit, which I perceive. I mean, it's personal opinion. So please, we still need Stop TB Partnership to play that facilitating role. That's even if we still have to all our efforts has to be homegrown, at least from many of the presenters and other colleagues have said. That is number one. Number two, one of those facilitating roles will be this, face-to-face discussion with the Global Fund. Good now that at least the buildings are face-to-face or adjacent. So I think the people also should be able to speak to them. This double standard about how they treat stop-TB partnerships in different countries is totally unacceptable. We had the same experience in Nigeria, and they told us categorically, and with record, that Global Fund does not, support any national TB partnership. So reading from my colleagues that Global Fund is supporting them was a shock to me, and I find that very interesting also, because what we advocate for is that there should be some form of support. The PR was willing to say we'll be able to take up some things. Lastly is there are some standards that are needed, but each country, each country is different, and the TB partnership in each country has to be based on the country context. I was surprised with what Philippines presented. I mean, apart from the fact that they've been there for a long time, the fact that they are providing services for us in Nigeria, that would be totally impossible. So every country must understand its context and be able to develop a partnership that can respond to that context. But overall, I think our role is to complement what all other stakeholders are doing to NTB in our countries. Thank you.
Thank you.
Thank you. We have time for one more question.
I'm going to be brief, and it's not a question but a comment. And I think we are agreeing that for us to do things differently from the way we have always done them, we need a game changer. And like I said, it is a stop-TB partnership. And now that we have new targets that we are working towards, that's the SDGs, then, and we are saying this is the vehicle that is going to deliver countries for that, to those targets, we need the national partnerships strengthened, and they can only be strengthened with the blessings from the global stop-TB partnership, because you can see the funding we have is, is from, not constant sources. Some are global fund, others. For example, me, I'm supported by USAID, and it was only running for 2 years. It ends 2017. After that, I don't know how I'm going to have it sustained. But if Stop-TB Partnership, for example, talked to Global Fund and said, hey, we know we have a channel that we can channel the money through in the countries, we are sure that Global Fund would be willing to channel some money to Stop-TB Partnership. And as you can see, with the little we have received, you can see what the countries are able to do. We can do much more if we had more funding, more sustainable funding.
Thank you. I just want to say something.
Okay.
In Ghana like this, I think 2010, and then 2011, now, civil society organization, now we were struggling to have money through the program. But the program manager said, no, I'm setting up a secretariat, and then all of you should come under the secretariat. If I'm using any money here and give to the partnership, I will write to the Geneva, I will write to the people of the Global Fund that this is what I'm giving to the civil society organizations. That one you have, but if all of us, we are not under the umbrella, we cannot receive money. But since he is able to put that measures, in fact, Ghana, we are doing well. All the sectors. So if when you come to Ghana, you can even say, if you want to, if they came to the monetary, so go to even Western region. People are there to give you all everything. So I think we have to, okay. No, follow up.
What I want to say is that if you don't have a plan to show results, you will not get money from the Global Fund. The partnership must have solid plans how they are going to contribute to achieving the national vision. Like you said, you are all working towards the national vision and goal. How are you demonstrating the partnership contribution to those targets and goals? If you do that, you can put it in the concept note because you contributed in developing the national strategic plans. It could be part of the country. You are an implementing partner to achieve the national vision and goals. And the budget will come. That is the only way. If you want the budget to come to you because you are a secretariat to run an office, you will struggle. It will be tough for you. But you can get the same resources through the concept note, linked to results, deliverables, and you'll get them.
We did that. Money was allocated for supporting the partners. But Global Fund, like the Nigerian story, just said no. So you are okay because they tried to give you and they never stopped. They are unfortunate, we are unfortunate because, so that's why we are saying the Global TB Partnership should tell Global Fund that this way is how you will actually be able to make your money work at country level, because the NTP alone will not be able to do other things. The civil society is at the community. They reach certain places which are not reached by hospitals or clinics. So the Stop TB Partnership becomes a vehicle where the Global Fund will effectively be used to achieve the goals they want. This needs to be talked to Global Fund by Global Stop TB Partners, because they won't listen to us at the national level. They think we want their money. But someone whom they can understand needs to explain this. So what you are saying, Dr. Frank, we did it, and money was there, and we even interviewed people, we even put people in the secretariat. But then all of a sudden, Global Fund said, no, we don't know what this National Stop TB Partnership anymore is. We cannot release this money up to today. Minel, if she was here, she will understand. We talked and appealed for them to speak for us so that that money can be released. They didn't release it.
Thank you.
Well, thank you very much, everyone. Obviously, this is a conversation that is not anywhere near over, but I just want to thank everyone today for such lively discussion and for such great presentations. So we could give all of our presenters another round of applause, please. And thank you to all of you.